You know you want to birth with a midwifery team. However, you aren't sure how to choose the right one for you. Today, we are speaking with Sarah Tunney, a very experienced midwife, to chat about why experience matters, especially for high-risk pregnancies and deliveries. Thank you for joining us. This is Preggy Pals.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggy Pals, your pregnancy, your way.
Welcome to Preggy Pals. My name is Emily Mason, and I'll be your host today. If you haven't already, be sure to visit our website at newmommymedia.com and subscribe to our weekly newsletter, which keeps you updated on all the episodes we release each week. Another great way to stay updated is to hit that subscribe button in your podcast app. And if you're looking for a way to get even more involved with our show, then check out our online community. It's called Mighty Moms. That's where we chat more about the topics that are discussed here on our show. And it's also an easy way to learn about our recordings so you can join us live. Our guest today is Sarah Tunney. Sarah is a midwife trained primarily in low resource settings outside the U.S. and as a community midwife for the Amish in Lancaster County, Pennsylvania, where she developed birth emergency and newborn assessment skills to ensure experienced care for families. Sarah has 25 plus years working in the field of maternal infant health, with the last 10 as a professional birth worker. Sarah, thank you so much for joining us today. Can you please tell us more about yourself and your practice?
Thanks, Emily. Hi, nice to be here. Well, what can I tell you? I have become a midwife. It was not my first career. But it was definitely a calling more than a job. And I'm living in California now, so my practice is based primarily in San Diego County and Orange County. Very different from where I trained, but I do find that the skills that I honed are really, really helpful here with families. Most of the time, my practice is primarily home birth families, but I do full spectrum reproductive care, and I care for families with twins, expecting twins, VBACs, breaches, people who are, I wouldn't call them higher risk. I mean, these are all variations of normal, but people who've had multiple losses, that type of thing. So yeah, and I love where I am now. I'm in a really rich community of birth workers and support for home birth. And I feel really, really fortunate. I get to work also with other amazing midwives and doulas and doctors, and the hospitals here are, for the most part, like very, very cooperative and collaborative with us. So it's a great spot. I feel really, really lucky.
I am so excited to dive into this topic in more detail with you, Sarah. But first, we're going to take a quick break. Today, we're discussing why experience matters, especially in certain birthing situations. So this is an easy question on the surface, Sarah, but what is a midwife?
Yeah, no, it's a really common question, especially like compared to what is a doula, right? So a midwife means actually different things depending on where you are. In general, midwives are healthcare providers. They provide reproductive care. So whether or not the person's pregnant or just of reproductive age, we can be a provider for most things: labs, tests, ultrasounds, family planning, physical exams. We also do newborn care. So licensed midwives, at least, and certified professional midwives, we're trained to work with newborns for their first 6 weeks. So that's another component. We also have a holistic view of the person, right? We look at you as a person, not just a condition that you're in that we're trying to address. So we do look at your family and your history and your emotions and weave that into the care. So it's a midwifery is a different model of care from obstetrics and gynecology, but we essentially do, we cover all those things, the quote unquote medical stuff too, but we just approach it from a different angle.
And I heard you mention the word doula, and I think people oftentimes confuse a doula with a midwife. So can you explain kind of the similarities, the differences, the overlap, how those two individuals can work together for mom, baby, and family?
Sure. So doulas are not medical providers. They don't have medical training, or if they do, it's circumstantial. But they're really there to provide emotional, physical, informational, like educational support for you during pregnancy and postpartum. I mean, they're very valuable. It's to have a resource like that, I find it's really important because, this is, at least from my mind, pregnancy and birth and postpartum are not medical experiences, right? They're physiologic experiences, and there's a huge transformation and a lot of vulnerability. So doulas are really there to be emotional support, but they're not there, for example, to assess if baby's okay or if mom's okay, or to take blood pressures, or that's not their job. They're there to be a resource for some of the things that might require just a more intimate relational experience. If that makes sense?
Yeah, that does. Absolutely.
I don't know. You're a doula, right? So what's your perspective?
Absolutely. I am definitely there for the families on that, I would say, mental health level, emotional, physical, to the point of not medical physical. Like, where are you at in your body's recovering from something? So where are you at in your recovery process? And is it out of the norm? So I definitely think that there's things where I, as a postpartum doula, identify, hey, that may not be, within a norm, but I'm also not a medical professional. So how do I bridge those gaps? Like, how do I encourage you to go talk to your midwife and have that conversation? So I definitely think there is a lot of overlap and a lot of teamwork that can happen between doulas and midwives.
Yes. Yeah, absolutely. I'm always grateful when we have a really good doula with us at the birth or postpartum, because then I feel very reassured that family is going to be well resourced. They're going to find, they're going to figure out, even if it's not for me, the right person to go to, maybe for some like emotional support, like social supports, all those things. Yeah, absolutely.
And I don't want to say the word rules, but are there rules of what a midwife can and can't do?
Yeah, well, yes, there are some very clear rules, actually, depending on where you live. So if we're just talking about the U.S. at this point, we'll just kind of keep it confined to the United States. Each state has a different scope of practice for midwives, and there are different types of midwives. There are nurse midwives. There are professional midwives and licensed midwives. 35 states have licensed midwives. And so with those licenses, midwives have a very specific scope of practice about what they can and cannot do within their medical license and within the confines of the law. So as an example, I'm in California. In California, midwives are not able to attend births of twins, breeches, if there's not a doctor present. Like it's for licensed midwives. Whereas in Utah, they can. And Texas. So it does vary state to state, but pretty consistently, things that midwives cannot do. We cannot perform surgeries, right? We can't do a C-section. We can't use any kind of artificial or forcible mechanical means to get baby to come out, right? So we don't use vacuums and forceps. Now that's licensed midwives. Now certified nurse midwives, if they're within a hospital setting or a clinical setting where they have those opportunities, that is a different, but they're also midwives, right? But they may have the capacity and the ability to do that within the scope of their practice. And midwives, so for example, in California, licensed midwives, we have a limited amount of prescriptions that we're allowed to fill, like a limited number of drugs that we're allowed to use for our clients. But in Washington state, licensed midwives can prescribe antibiotics and some of the sort of more basic things. So it really depends on where you are.
Interesting. So I know you've had a lot of experience. You said you're out in California now. Previously, you've been East Coast, Pennsylvania area. What is your expertise when it comes to working with birth mothers? What's been your experiences? Fill us in. I just want to know everything.
Sure. I actually started out as a doula in New York City and Connecticut. And so I did a lot of hospital births and birth center births there. And that was really interesting. I learned a lot about how to assess where someone is in their labor without doing any kind of physical exams, right? And and that was, I lean on that quite a bit, because in my own practice now, as an example, I don't tend to do cervical checks routinely during labor. I don't feel the need to do that almost ever unless something is clearly dysfunctional. And so I think, my expertise then developed. I sought out experiences where I was in settings where we couldn't just transfer to the hospital. We didn't have any other options. Like, this was it. So one place I went in Pennsylvania, which was to work with an Amish community. And there were hospitals within an hour or so, but the community themselves really didn't want to go there unless it was a life or death situation. And then I've had some experiences in low resource settings outside the US. So I feel like that's where my expertise has really come through most, is the low resource setting, whether it's a very rural setting where we're not near a hospital and we really need to deal with any emergency that comes up, or we're in a setting where we don't have resources, meaning we don't have ultrasounds, we don't have lab values, we don't know what's coming out, we don't know if it's twins, we don't know if the baby has a deformity or a defect, right? And so then managing what happens with that birth. I feel like that's the main one. And then I think the other thing that I've been really lucky to be at the beginning of my journey with is really managing people who are pregnant with twins. And I feel like I got a good taste of that when I was in Pennsylvania. And now in California, I'm able to do some of that learning as well. That's becoming an area of expertise for me now, which feels really good, because I think for the most part, when folks find out that they're having twins, they assume that they're just automatically in with a doctor and that they can't have midwifery care. But that's not the case at all. Twins is a variation of normal too, and so midwifery care is actually shown to be, arguably, we have better outcomes with twins, twin pregnancies than higher risk, higher surveillance rate care.
Well, that is some great expertise to have, because that all sounds, I don't know if it's thrilling, like to not know what to do, but then to be able to just respond. Those are the people I think moms and birthing people need, are those people that are there and ready to respond and are making decisions based on the mom and the baby and the whole family. I think that's really important.
I had a really wise midwife say to me that, birth is as safe as life is. And I remind families of that too, because while you can have the most experienced, skilled attendant, and that can be even at a hospital or at home, wherever you are. But, and there are some things that no matter how skilled you have of an attendant, that, there's still things that there are out of our control, and that happens too. But I do feel like what I've noticed is that the safest births are when the people present have some experience, have skills, have been and have learned from other midwives or doctors or whomever they're learning with, who also have lots of skills and lots of different kinds of skills, like a big toolbox. And so as a result, yes, some of it's the skills themselves, but what I find is it's always the calmest person in the room. And so if you
Right.
have somebody who has seen a lot of complications and also seen that everything works out okay, and we just have to do some simple stuff and everyone
Mhm.
just needs to stay calm, then things tend to work out really well. And
Right.
I think that comes with confidence and experience.
Absolutely. And so I kind of perused and found your website. And on your website, you mention birth is fundamentally a normal physiologic experience. Can you elaborate on what that means?
Yeah, I mean, I feel like it's a normal thing. It's like going to the bathroom. Like it's something that we do. Our body knows what to do if we just kind of give it what it needs and we feel relaxed and safe and we're nourished. Things tend to work out. We don't need to overcomplicate it. Now, every now and then something else is going on in the body and the physiology doesn't work right.
Mhm.
And so then things go sideways sometimes. But generally speaking, I think, we don't pathologize or medicalize puberty or menopause or,
Mhm.
just general. We're kind of built to reproduce. And it's like we eat, we drink, we go to the bathroom, we reproduce, we die. Like these are normal. These are just part of our life cycles, and all animals do it. So I feel like it's normal. We just tend to get in the way of it. We tend to get in the way of our own physiology.
That's a really good way of putting that. We tend to get in the way of our own physiology. Like that's fantastic.
Yeah. And I think the number one kind of culprit that I've encountered is the brain, is the mind. And
Mhm.
it's usually fear. That will halt your physiology like nothing else, right? It halts your digestion. It's the fight or flight. It's the cortisol
Mhm.
release. It's all those things. Cortisol blocks oxytocin. I mean, it's a 1-for-1. It's very obvious. We have clear indicators that, when we get scared or we're having an experience that is an inflammatory experience or something, like it interrupts the cascade of normal physiology, and then things don't work. And then we try to, jumpstart it or just get it back into its flow state. So, and I think that tends to be where we get out of sync with labor and birth and even like breastfeeding and postpartum, all of these things, right? We get in our own way by thinking about it too much and having too many things to do and having too many tests. And I mean, I'm a big nerd. I love tests. I love all the information. I give it all to me. But, I do find that most of the time it just leads to more anxiety and fear when there's really probably nothing to worry about.
Right. Yeah, absolutely. Well, so far I am super intrigued, and we have more midwifery questions coming up. But first, we're going to take a quick break. Welcome back to Preggy Pals. We are continuing our topic on experienced midwifery care. So, my next question is talking about the third trimester. What does it look like for women who work with you? How many visits are they having? How long are those visits? And is that more relationship-based care, or what's happening during that third trimester?
Yeah, the third trimester is when it all kind of gets real, So I tend to see folks once a month up until then at 28 weeks. Then I see them again at 32 weeks, assuming everything is normal and it's a singleton pregnancy. So 28 weeks, 32 weeks, and then it gets more frequent, 34 weeks, 36. I usually do a what I call kind of a birth rehearsal at their home if they're doing a home birth, and everybody comes and who's going to be at the birth, and we spend a couple of hours together and we go through everything, and I bring all the gear, and we really get down to all the questions about what happens if there's an emergency. What do you envision for the birth itself, and what does the immediate postpartum look like? So that everybody knows that they feel more at ease. They can ask me any questions they want to, and I have a great sense of what they're really, really wanting out of their birth experience, and then how I can support them. Like I can try to support their vision. And then I see them at least once a week until their baby's born. If we get to 41 weeks, then I'll see them more often. And I offer them additional surveillance in the form of a non-stress test or an ultrasound or a biophysical profile. These are things just really to check in on how the placenta looks, how the baby is growing, how much amniotic fluid there is. But it's their choice. It's not required. But I do offer that if that feels intuitive to them to do. And then really it's mostly just about, we're always checking to make sure that mom and baby are doing well, right? That everybody's in good shape. And we do a little bit of preparation for if they want to, for labor and birth. They should have already done a childbirth education class. We talk a lot about postpartum care and breastfeeding. So if that's what they want to do, I very much want to make sure that they're lined up for that postpartum. I think of postpartum as really a full another trimester. It's really 12 weeks. It's not 6. And frankly, I feel like we give a lot of hype to the birth itself when actually the postpartum can be some of the most taxing. It's like long-term taxation on your body and your mental health. And so just setting people up to feel resourced, that they have someone to feed them and to take care of the rest of the family or the chores or, whatever it is that needs doing, not just the first week or 2, but past that. And I usually make sure people have, if they're wanting to do some kind of herbal preparation for birth, that they have all that lined up. And then some other, because I'm also a bit of an herbalist. I really love herbs. I see them working really well for people and just, nutrition. So we talk a lot about nutrition for the postpartum and for lactation. And then, families do what feels right to them ultimately. But the third trimester is a lot of interaction. We spend a lot of time together.
Yeah. And you touched on it, I think a little bit when you were talking about you have the birth rehearsal, but what else do you do to help mentally and physically prepare the mother for labor? What kind of, how do you get her over that fear? I know from a person that has had a baby, it was the fear of the unknown at one point in time of like, is this going to hurt? What's this going to feel like? And I knew, like, I'm a well-educated person. I know it's going to hurt to an extent, but it's that fear of the unknown. So how do you get them kind of mentally and physically ready for that?
That's a good question. Well, I started doing classes for my clients, and they're open to the community too. I just started doing that because I do feel like a lot of folks, they do these childbirth prep classes, but then they're still, they're not quite ready. And especially out of the hospital when there's no medication option, we don't have pain relief. So, I think some of it is really trying to redirect that a bit with the advice that I've seen that really works. And the first thing is to stay positive, because it's very easy to get into a fear space, or I can't do this anymore, this isn't working. And it's not that those things are not valid, but frankly, they just don't serve families in that in that moment, right? And so addressing that a little bit in advance of like, how do I get myself through those moments of self-doubt or fear? What is it that I need to hear? And so my hope is that people resource themselves, or their partner is that person for them. But if it isn't for any reason, then in the moment, right? And sometimes we just encounter things in labor we don't expect. Things come up, things that we've either buried or just they've gone far down and they come up. There they are. And so I feel like part of my job is to continue to remind people, especially during labor, that they're safe and that they can do it. And if sometimes you just need another person to hold the space of like, I'm going to tell you when it's not okay, but you can do this. So let's just do this for 5 more minutes. Let's do this for 10 more minutes. And then we can reassess. And usually that honestly gets people over the bridge. It's just to come back to their breath. Because in labor, you can control very little, but you can control your breathing. If you can get your mind to do that. So the thing I ask my families to practice in advance is breathing and getting really deeply relaxed in 60 seconds. Because as you know, like at the height of your labor, you get a 1 minute break before the next contraction. And so what I love is if people can really tap into, create muscle memory almost of deep relaxation in 60 seconds. And it works. I mean, people can relax and you just are able to let go.
And you touched on this too with having the partner identify some of the ways that mom reacts. I know sometimes in my birth, I was like, I am amazing. But my husband's like, the second she gets hungry, it's bad news for everybody. And like, he could voice that to people, or like when she feels like she's backed into a corner, she'll just yell at everybody. And I was like, oh, do I really do that? Oh my gosh. And he's like, I just know how you react to stress. And that's where he was able, because in my world, I'm like, I don't ever get stressed. I don't know what you're talking about. And he's like, yeah, you do. But I think that's where partners can be a great resource to be able to really give you, and maybe, your mom, mother-in-law, the people that are really going to be there as your circle of care, helping, or in the room, or even after, my mom knows more about me than I know about me, and she's able to give some insights. And so involving those people, I think is super important. And you touched on having your partner, involved in that, but how else do you bring partners in? What role does the partner play?
Well, it really depends on the family. I mean, they really decide. Some partners, like they'll have some partners, they want to catch, they want to do everything. That's great. Other ones are like, can I just stand in the corner and let you and the doula take care of this person? So, and it does depend very much on the nature of their relationship and what they want. So, but I do find that nowadays, most of the time, it's whether it's me or the doula or a combination of us, really helping show the partner like, hey, why don't you try pressing here? Why don't we give you two some privacy? Because there's the things that get babies in, get babies out. Oxytocin is that feeling that you get when you fall in love, when you have an orgasm, right? When your baby's nursing, like you have that nipple stimulation. Like that's oxytocin. That is, if you smell your person's t-shirt, it's like stinky, but it just makes you feel like, oh yeah, that feels good. Your whole nervous system just comes down. You have this big letdown. And so trying to preserve that oxytocin flow is so great in labor. And a lot of the times it's really just letting the two people who made this baby together in whatever way they did have some privacy and maintain that intimate space, because it's ultimately their family and their experience. And so I do find that, frankly, most of the time having a partner who is positively affecting the pregnant birthing person's nervous system is one of the most important pieces of and predictors to having a successful unmedicated birth, whether you're home or anywhere else. And without it, I mean, obviously people give birth alone all the time. And around here, we have a lot of military families. A lot of guys are deployed, dads are deployed, but, and it works out just fine. But man, it works out really well when you have a partner who you just sink into and just holds you and you feel safe with.
Absolutely. So switching gears, we've talked about how to prepare mom during labor, but anxieties can kind of ebb and flow during the whole pregnancy. What are some tips or some nuggets of advice that you can give to women who are interested in working with a midwife, but they're nervous that they may be turned away for whatever reason? What are some tips there?
I don't really understand completely some midwives turn folks away for whatever reasons. I can't get into their psychology and OB practices too. But what I find is that when a person is very clear about what they need and want, and they are resourced and educated. By resource, I don't mean money. I just mean, they're able to say, well, look, I've been reading about this, and I feel like these pieces are important to me, and I'm going to find these things, and I'm going to line them up, and I'm going to do this research, and I'm going to, they take the responsibility and the ownership for their pregnancy, their birth, their family. And I think that whether or not the person is over 35 or has had a cesarean or is having twins, or trying to think of some other more common examples, or, even just somebody who is maybe doesn't have the greatest diet, or has had sort of more than one loss, like things that you're like, oh, are they not going to take me? I just say, resource yourself, but also be yourself. And if the midwife that you approach or the doctor that you approach doesn't want to take you, then just know then you're not with the right person. And and that's not about you, it's about them. And I think that, in general, good candidates for out of hospital births, for example, and there are a lot of midwives only do births at birth centers and only do births at hospitals if you're a nurse midwife, right? But if we're talking about more midwifery care outside of that setting, then, don't sell yourself. Just find the right person. Just keep looking. just be yourself.
I wholeheartedly agree with that. I think I'm a question asker all the time. And I'm always investigating. And I look at having my youngest, when I gave birth to her at 35 weeks, I had a diagnosis of gestational diabetes. And my midwife said, I have to transition you into a OB.
Yeah.
Well, I totally understood. And I was like, absolutely. But my next question was, how do I prevent this from happening in the future? Because I want to make sure, is it something I can prevent? Is it something that, what are the signs? What do I watch for? And I think that's where sometimes people get in their own head of, well, it's happened to me once, so it's going to happen to me again. And that's just what I'm going with. And I think it's always important to ask those questions, uncover every rock, figure out, just because every birth is different, every pregnancy is different. And so next time I may not have anything, or I may have it way earlier. We don't know, but we don't know what we don't know. So figuring out how to ask those questions, I think is important, definitely, for women to not sell themselves short, like you said, or oversell themselves or undersell themselves.
Yeah, I agree with that. Absolutely. As I'm reflecting, listening to you too, especially like in the situation like yours, right? Then one of the things that a person can do, let's say they had a pregnancy or a birth, and it didn't end up in, it had some sort of quote unquote complication, right? And it's true. It just because it's happened in the past does not necessarily mean that your future is completely determined in terms of your reproduction, right? In most cases. And maybe going and establishing care with a midwife, if you want to do midwifery care when you're not pregnant, and getting yourself in a really, really good state, even, before you conceive. And then, midwives this is one of the things that, midwives are really good for, at least we should be, right? Is keeping people low risk and helping them, if, staying low risk. And if you're not low risk, getting you low risk, and not doing it with medication if we don't have to. And if we have to, that's fine. But yeah, I think that's kind of the goal, is let's do all the things that we can to stay in that bubble, like bumper rails. And if you go outside, come back in. And I'd say 99% of the time you can, and maybe that's an exaggeration, but like 7% of the time, folks can come back into into a low risk. And by the way, just as a PSA, I saw some posts recently about moms who are over 35 being told that they're high risk. And it's just not true.
Right.
That you're not high risk. You have some slightly higher risks of a couple of things, but it's not a high risk pregnancy that requires a maternal fetal medicine doctor. And so I do hope that folks can hear that. I had a mom who's 51 have a home birth. It's not just because you're over 35 doesn't mean almost anything, except that, you probably were born in the 70s or 80s and you like different music, whatever.
Right. Wow. Thank you for pointing that out and bringing awareness to all of these misconceptions that people have. I'm excited to continue talking more, but first we have to take a quick break and then we'll be right back with some more midwifery questions. Welcome back to Preggy Pals. We are continuing our topic with Sarah. And our next question, Sarah, revolves around what should pregnant moms be looking for when they're looking for that midwifery care team? What kind of care, insurance coverages, other questions? What do you advise moms to do in this situation?
Oh, yeah. Well, so much of it depends on where you live, right? And how much choice you have. So I think in most places, folks don't have a huge amount of choice because maybe there aren't that many midwives who are in their geography. That's the first question is, who's close? Like who's going to be close enough? And then also what type of midwife it is. If it's a certified nurse midwife versus a licensed midwife or a professional midwife, you definitely want to make sure that the person has a credential, right? So they're either depending on what state you're in, they either have a license or they're certified through the national certification. So you want to make sure that they're actually midwives, because there sadly are people who kind of bill themselves as offering midwifery care, but they're not, and they don't have the training, they don't have the equipment or the medication. So be aware of that. And then I think you want to find out what their experience is and how quick they are to transfer you if something goes wrong, right? Are they going to immediately transfer you out of care if one thing is off, or are they going to work with you and try to resolve it first? Or, sort of what are their boundaries? I think that's a good question to ask. And insurance. Well, insurance is the big bear in the room. Again, it depends on it. There's different types of insurance and different states have different rules, but by and large, most insurance will cover midwifery care to some extent for the prenatal care and your postpartum care. And they'll often pay for the midwife's time, but what they won't pay most of the time is what's called a facilities fee. Especially whether you're at a birth center or at home, unless the birth center is licensed and accredited, which is frankly really hard to do, and most are not. We have a lot of birth centers closing in California because of that. So insurance won't pay them back. But some insurers will pay everything for your care, like these health insurance co-ops. Oh, they get it. They get that it's less expensive to have midwifery care and have your birth outside of the hospital than it is to have conventional care, lots of interventions, hospital birth, surgical birth. They get it. So they pay. And so figure out what your insurance situation is. And some insurance will only pay for a nurse midwife, and others, depending on your state, you are entitled if the insurance says that won't cover a licensed midwife, then there are some legal settings that you can refer back to that you are entitled to a licensed midwife. You are entitled to this care, which is, I won't go into now, but you do have rights. And so, but sometimes you just have to be the squeaky wheel. Yep. And then I think the other thing that is good to ask, especially if you're getting a midwife and they're, most of it is cash pay, right? You pay for your care in advance. And so understanding if they're going to go out of town, if they have a backup, if you end up getting transferred out of care or go into labor and it's before your 37 weeks or whatever, 36 weeks, depending on the state, what's their policy for refunding you? Will they come with you to the hospital? Will they do your postpartum care just like you had planned? Things like that. I think those are good questions to ask about, what kind of care can you expect even when it doesn't quite go to plan?
Absolutely. And those are some, I think, great beginning interview questions. But just as much as parents are interviewing the midwife is, doing the same thing, interviewing the parents to ensure that they're a good fit. So what questions are parents asking you during that interview process, or that you think they should be asking you to really find that good fit?
Yeah, no, that's such a great question. So some of the things I just listed, are questions I love. I love it when they ask me point blank, because I know that then I know they're being thoughtful and they're probably, it's not maybe their first rodeo. The questions I like hearing are questions like, what would you transfer me for? Whether it's during pregnancy or during labor, at what point would you say I'm out? As the midwife, right? And I think that's a good question to ask the midwives, because you want to assess, you also want to ask them, what their training is. Like, where did they train? Did they train with more than one midwife? Like how many births have they attended? And that doesn't always tell the whole story, but there are lots of really good young midwives. Just because you're newly licensed or something doesn't mean you're not actually a good midwife or a great midwife. But I do think that if you've only had one teacher, as an example, you've only ever been to 50 births and you only ever worked with one person, then chances are you just don't have a lot of skills yet, and that's okay. But maybe who else are you learning from? So I like it when folks ask me if how I feel about induction. I like it when they ask me, how do you feel about declining tests, whatever it is, GBS, or and I think asking a question like, well, what would you do if I tested positive for GBS, right? And that's a test that you do at the end of pregnancy to see if you have a bacteria. And I think that's a really telling. The answer that you get is really telling, and I think it's a good question. And then I think the other one is, it's not a specific question, but in the end of the day, the good relationships, like most relationships, are ones of trust, and the trust has to go both ways. And so if there's a breakdown in the trust, then, how do we either rebuild it or be honest about it and then make a different decision. But if people trust each other in this context, then things work. And if they don't, then they just don't.
Wholeheartedly agree. And I could probably just sit here and talk to you all day, and I'm sure our listeners,
likewise.
I'm sure our listeners would feel absolutely the same, but I want to give them a chance to find you on social media, a website. So where can our listeners find more information about you, and learn from you even more?
I'm horrible at social media, I'll be totally honest. So I have a website, which is just Sarah Tunney midwifery.com. It's not that original. And so people can check that out or reach out to me. That's probably the best way to contact me. I have an Instagram page, but I just started it, so it's not great. It just has it just exists. And then my LinkedIn page is my professional page. But yeah, I think probably the best way is just through my website, and happy to chat with people and get to know them and answer questions. And, certainly if they're wanting to know about care with me, that's fine. But also I love to collaborate. I'm actually going to a conference in about a month, an international conference in Dubai. It's one of the International Confederation of Midwives conferences. And so I'm going to do some talks there, which I'm really excited about. I love to meet people all over the world, because we get to just exchange what's working, what's not working, how we can get better, how we can have better outcomes. And I just feel like it's really valuable. So yeah, I love meeting people and chatting. Don't be shy.
This has been fantastic. Thank you so much for joining us today, being on this episode.
My pleasure.
And for those listening, be sure to check out newmommymedia.com, where we have all of our podcast episodes, plus videos and more. That wraps up our show for today. Thanks for listening. If you love Preggy Pals as much as we do, please consider checking out the amazing businesses that sponsor our show week after week. And we'd also love for you to tell another pregnant mama about this resource, which, of course, is absolutely free. And if you want to check out some of the other podcasts we produce, such as Newbies, Parent Savers, The Boob Group, and Twin Talks, then visit our website at newmommymedia.com. Thanks for listening to Preggy Pals, your pregnancy, your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording, so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.